Now, the fallout of the pandemic and its impact on our health has been talked about quite at length. We on FYI have covered various aspects, the impact it's had on our heart, the impact it's had on our overall health, and specifically on our mental health and those of our kids as well. And in series of those conversations, today we bring to you an issue which is not much talked about but so pertinent: the rise of obesity amongst children as a fallout of the pandemic. So without any further ado, let's tell you what exactly is it that we know about this so far. Now, tackling childhood obesity is a problem that India and the world in fact has had for quite some time. The National Family Health Survey, conducted in fact before the pandemic actually hit us, showed an increase of obesity in children in 20 of the 22 surveyed states where it was actually done. Healthcare experts have warned of the rise in obesity amongst children due to the pandemic as well, and NITI Aayog recently organized a national consultation on prevention of maternal, adolescent and children obesity just about last week, about 25th of June. NITI Aayog also then said in its recommendation that a need to whole of the government and society to approach this is very important, saying it is a twin challenge of, at one hand, tackling obesity, on the other, undernutrition and malnutrition altogether. So on the program today, let's try and understand how widespread this problem really is. It is not bound by borders, and it is not only in India. In India, there has not been any survey done on this so far, apart from the one that we just talked about that was before the pandemic, but across the world, lots of studies being done about this. Let's tell you what's happening in United States. In Philadelphia, they did a survey where overall childhood obesity prevalence increased from 13.7% in 2019 to 15.4% post the pandemic. Increase was more pronounced in patients and in kids aged between 5 to 9. In Italy, a survey was done during those only 3 weeks of home confinement. And they, in their conclusion, took out that intake of chips, sugary drinks increased the time spent on sporting activities and decreased, and thus the people were spending much more time on screen and thus not so much out on the field. Another one conducted in Lausanne, Switzerland, said that 40% of children reported eating more snacks during confinement, and that led to increase in screen time as well in 75% children. Increased screen time continued even 3 months after the lockdown in 37% of their respondents. In a survey in Virginia, Commonwealth University, it said that 30% parents reported that their children gained weight during the pandemic. All in all, it basically goes on to tell you how widespread the problem really is. And this time around, you can't just blame the child, it has to be the attitudinal changes around them as well. So let's try and understand what exactly is childhood obesity altogether. Well, how obesity is calculated is a formula that we'll discuss on the program, but primarily it is dependent on 3 things. One is behavior: physical activity, sleep routine, screen time, medication. Then there is diet. Huge component, what you're putting inside you, the consumption of high calories, low nutrient food, beverages as well. And then there are genetic factors. But look at this statistic. Genetic factors alone account for less than 5% cases of childhood obesity. What does that mean? That means that 95% of the cases, or in fact more than that, kids are adopting or being pushed into obesity because of factors around them. It's not always genetic. It's how the child is being brought up mostly. So why is this really happening, and what are the experts saying about it? Well, some factors, as we already know, like children being confined to their homes, facing higher risk of obesity in the pandemic. That's practically all of us, remember, all kids as well. Closure of school, parks, disrupting children's routine as well, higher intake of junk food, reduced physical activities, indirect impacts like health, mental health impacts, social isolation, increased screen time, all of that contributing to children as young as 2 years old gaining more weight than they should be. And early childhood, remember, is said to be a key component on the attitude the child adopts when they're actually growing up. But why exactly is obesity such a big problem, especially in kids? Well, because the weight gain could contribute to COVID-19 complications in children. Obese children are prone to early onset of heart problems, diabetes, hypertension. Nutrition also linked to immune system, disease susceptibility as well, an effect on the child's self-image, confidence, increased risk of depression and anxiety as well. Remember, in India, there is obviously a problem. We are used to having kids being slightly overweight than they should be, and that is considered to be cute, it's considered to be healthy, but all of that could go the wrong way as well. So what should you as a parent be doing about it? Well, some suggestions again that FYI team has put up for you. Ensure that at least 30 minutes of physical activity, even at home, 4 to 5 times a week, is maintained. And there are some simple steps really. Skipping, dancing, using the stairs can really go a long way. Increase children's fruit and vegetable intake, regulate junk food, help children maintain a proper sleep schedule as well, 8 hours a day and regulate screen time as much as possible really on that front.